Hello, I'm Dr. Isabel Cumandra, and today I'm going to talk about tips for taking care of your kids' teeth, as well as when's the best time to visit the dentist. So when it comes to babies, I get a lot of questions about when should they start brushing their teeth. So in general, kids will get their first tooth around 6 months of age. Even before teeth are present, what you can actually do is with a clean, warm washcloth, you can actually cover your finger with a washcloth and then gently just wipe off your child's gums even before the teeth are in the mouth. What this does, it just helps get your child used to you putting something in their mouth and moving something around. Then when the first teeth erupt, definitely the best thing to do, preferably after each meal if possible, is take that clean washcloth and just wipe off any food or debris that may be in your child's mouth. As your child gets more teeth, that's when you can start to use a toothbrush. You can use a regular child's toothbrush. They have them usually divided by certain ages. So you can pick a fun one that your child would like. And at the beginning, you'll be using the toothbrush without any toothpaste. So just a wet toothbrush, and you'll gently brush all the teeth that are present. And it should be done at least twice a day. And the most important times to brush, so number one, brushing before your child goes to sleep, after they've eaten and had all their food for the day, so that they're going to sleep with a clean mouth. As well, in the morning, the best time to brush is actually after your child has eaten breakfast and they're ready to go about their day. So you're brushing off the debris that's in your child's mouth before they're heading out for the day. Now, for a child, depending on how many teeth are present, the brushing shouldn't take longer than a minute. A minute is probably good. If all the primary or baby teeth are present, about a minute should suffice. So another question I get very often from parents is, when should they start using toothpaste to brush their child's teeth? So there's no set age at which you should introduce toothpaste. It all depends on when you trust your child to reliably spit out the toothpaste. You do not want to use toothpaste in a child that's just going to swallow it all. It's useless, and it can actually cause harm if the child swallows a lot of toothpaste. So wait until you trust them to spit it out. Once you do introduce toothpaste, you only need for your child literally the size of a grain of rice. The size of a grain of rice is all you need, and then keep an eye on them. Make sure they're going to spit it out. In terms of the type of toothpaste to use, so there's a lot of different brands out there, a lot of different ingredients, types, etc. It is best to use one that's specifically for kids in your children. Whether you want to use one with fluoride or without, with natural ingredients, etc., that's totally a personal preference. So for flossing, flossing should be introduced once your child has tight contacts between the teeth, where basically the toothbrush doesn't reach in between. You want to use floss at least once a day to clean out any food, bacteria that has lodged between the teeth throughout the day. What this does, it helps prevent cavities from starting in between the teeth. There's those little flossers that are super easy to use, and makes it easy for your child and for yourself. So just some other quick tips about preventing cavities. In kids, one thing that's not a good idea, or that's best to avoid, is actually putting your child to bed with a bottle with milk in it. What happens with the milk is, if they don't get brushed before they fall asleep, then all this milk sits in their mouth overnight, and milk contains sugar, and it can really increase the risk of cavities. So if you're going to put your child to sleep with a bottle of milk, definitely brush before they go to sleep. Otherwise, give them water. With bottle feeding, bottles, pacifiers, soothers, even thumb sucking, what can start to happen is, when this habit is prolonged, it can actually start to change the positioning of the teeth and even change the shape of the jaws, where you're actually changing the positioning and the shape of your child's upper and lower jaws. So any habits such as thumb sucking, pacifier, bottle feeding, etc., the sooner that they can be broken, the better. If the habits are stopped early, usually it doesn't have any long-term effects. If the habits continue through to when the child does have permanent teeth, it can cause permanent changes. So one really, really important thing that can help prevent cavities in your child is limiting foods that are high in refined sugar. This means candy, sweets, pop, fruit juices, anything like that that has high sugar content. Fruits themselves are actually good because they contain fiber, and the way that they're consumed, they're not as cavity causing as, let's say, candy or pop or juices, things like that. So the best thing to do is not to keep this stuff lying around, not to keep it available to your child at all times. Not buying it is even better. Having sweets and candy, cookies, all that stuff, it's great to use as a treat once in a while, that's fine, but having it on a regular basis is just really cavity causing. So one of the other common questions that I get from parents is, when should I first bring my child to the dentist? So typically we would wait until your child has a few teeth in the mouth. Usually we would say around 18 months, you can do the first quick check, the first visit. So usually what happens at that visit is your child comes in, we kind of let them get familiar with the office, we show them the chair, we show them the tools. Usually, depending on the child, they usually have to sit in the parent's lap. We usually just take a quick look in the mouth. We're just looking for any abnormalities, any signs of decay, or anything that we should just catch early. And then we can also talk about techniques for brushing, for keeping your child's teeth clean. And then we usually don't do regular cleaning appointments or dental visits until around 2 years old. So that's when your child will have all their baby teeth. They'll have about 20 teeth by that age. And that's when usually they'll sit in the chair by themselves and let us do their polish, their cleaning, etc. Thank you so much for watching. Hope you learned a lot about taking care of your little one's teeth.